When our communities need help, Blue Cross and Blue Shield companies step up with partnerships capable of preparing meals for thousands of families in need. Because it's not just about health insurance. We believe it's our responsibility to expand care to rural communities, protect our heroes with safety equipment, support local nonprofits. These are our stories to help build stronger communities for the health of America.
Second Opinion with JOAN LUNDEN is produced in conjunction with UR Medicine, part of University of Rochester Medical Center, Rochester, New York.
Adult obesity is associated with a decrease in life expectancy for both men and women, as well as an increase in chronic disease. It is estimated that 163 million adults in the U.S. are overweight or obese, 2/3 of men and more than 60% of women. The cost to our health is staggering, but people still struggle every day to drop the pounds. And today we will talk about how we can conquer obesity. Joining us is our primary care physician, Dr. Lou Papa, from the University of Rochester Medical Center.
It's a ladder, it's not a cliff. You got each step is beneficial.
Dr. Sheila Sani, interventional cardiologist and director of the Women's Heart Program at Sani Heart Center.
Obesity and heart disease have a continuous linear relationship.
Dr. Thomas Campbell, the director of Highland Hospital's Weight Management and Lifestyle Center and co-author of the China study.
We have an evolutionary body that's designed for an environment with scarce calories.
And the host of The Biggest Loser, author and personal trainer, Bob Harper.
You cannot exercise your way out of a bad diet. And if you start to put those two worlds together, you will just reap the benefits.
Also with us today is Becky Smith, who struggled with her weight for years. And today, she will share with us her life-changing story.
Everyone's journey is different. Just do what you can to do the best job that you can.
And I'm JOAN LUNDEN, and it's all coming up here on Second Opinion. Now, we all have different reasons for wanting to lose weight and keep it off, but we also know how hard it is to do. So I want to start today. Thank you to everyone on the panel, but I want to start with you today, Becky, because you're sharing your struggle. And you say, like a lot of people, you didn't have any kind of a weight issue growing up, but what happened in your 20s?
So after a lengthy illness, they put me on steroids. And as a result of that, I put on over 60 pounds in a short period of time. Then it's been a struggle on and off since.
If she had come into your office, Lou, as a primary care physician, and you heard what had happened, how would you advise her? What would you want to know?
So first and foremost, how long were you on the steroids, Becky?
Months.
Months. Okay, that's a little unusual to be on them that long, so I can see why you gained all that weight. And is there any obesity or overweight in your family at all?
Yes.
Okay.
Yes.
So those are two things. The steroids kind of increase your appetite, increase your weight gain, and unfortunately, your body, no living thing was really designed to be overweight. There was always an assumption there'll be a shortage of food. So our body treats fat like people treat money. You never can really have enough. And it likes having it around to survive off in case of times of starvation. So some of what I would ask you is, so what level of activity do you have and what is your diet like? Give me your typical diet for a day at that time.
At that time? Oh, it probably was not good because
It's okay.
Prior to that, I had no problems with weight. So I could eat whatever I wanted to, really. But there was a level of exercise and so on. And with the steroids, I was just tired,
Right.
very, very tired.
And I'll throw in, by the way, that the number one answer women usually give why they don't go see their primary care physician is that they don't want to get undressed and get on the scale.
Absolutely.
And they'll go years.
Right.
Only because, like,
right.
I'll lose some of this and then I'll go see you.
And and there are times we have patients come in the office, they don't want to get on the scale, but we have to kind of set up, as a primary care doctor, you know your doctor, we have to set up that room as a sanctuary. That's the place where we can talk about the weight. That's where it's a clinical issue. So you have to leave the groundwork. Okay, we're going to work on this. Do not be unrealistic. That's really important because a lot of people are very unrealistic. They want to lose it like that. You got to take it in incremental steps and change a lifestyle. And especially because you're on the steroids for such a long period of time.
Right.
And the problem with the steroids you were on is you lose muscle mass with that. So not only are you gaining weight, but you're losing muscle mass so that the weight gain is even accentuated.
And Dr. Sani, of course, that weight we all know is related to cardiovascular disease. In your heart center, what % of your cardiac patients are obese or overweight?
In my practice, the majority of patients are overweight. And when it comes to obesity, I would say an estimate as high as 20%. And I'm basing that off of your body mass index. And the reason is that obesity and heart disease have a continuous linear relationship. As we see the weight rise, we see the cardiovascular risk rise. And the reason is because weight, being overweight and obesity, is a facilitating causal factor when it comes to heart disease. So hidden in that obesity or the patient who's overweight are usually other cardiovascular risk factors, such as high blood pressure, high cholesterol, diabetes, and they interact with each other in varying degrees with each individual. So it's a tailored risk assessment that you have to make. When I evaluate a patient who's overweight or obese, I'm looking for certain things. I look at their blood pressure, their fasting glucose, their lipid panel, their hemoglobin A1C, and I can make an assessment of how that overweight or obesity has affected their overall cardiovascular risk assessment. What's key about all of these risk factors is that diet, exercise, and avoiding that sedentary lifestyle is the mainstay of improving all of them.
Dr. Campbell, why are we becoming an obese country?
My interpretation of what's been going on is primarily our environment is changing. You know, we have an evolutionary body that's designed for an environment with scarce calories. And so we get all the rewards when we eat rich food. Your brain rewards you with pleasure and comfort, at least in the short term. And so what we have is a corporate culture and a world culture that has been taking these incredibly processed foods, very rich in calories, added fats, added sugars, all the wrong stuff for weight, and just giving it to us sort of en masse. You know, whether we go out and want to buy something at the store, we got to run through the gauntlet of all the cookies and candies and chocolates, you know, to buy your thing. We have an environment that's encouraging us and pushing us to consume this, and it has in fact become very normalized. I mean, if you look at, you know, when TV dinners were first introduced, it was a while ago now, and we have now generations and generations of people who have gradually adopted that type of lifestyle. So we've lost some of the basic education and some of the basic skills that go along with healthy cooking and healthy eating in an environment that's absolutely pushing us in the wrong way 100% of the time.
And of course, you know, Bob, I've heard women say, well, I'm going to lose some weight. And then after I lose some weight, it'll be easier to exercise, so I'll start the exercise then. So what would you say to that woman that says, I'll get around to that?
Well, you're right. You cannot exercise your way out of a bad diet. And if you start to put those two worlds together, you will just reap the benefits. And I feel like what I try to tell people in the very beginning is that just start with small changes. Don't try to change everything all at once, because if you do think you're going to get up with all the best intentions, I'm going to eat, you know, broccoli and my brown rice, and I'm going to get on the treadmill and I'm going to do all these things that I know I'm supposed to be doing. Then all of a sudden by Wednesday, you're like, I'm tired, I'm exhausted, I'm sore. So I think the smaller you start and realize that you're trying to make a complete and utter lifestyle change, and that means this is something that you're going to be doing for the rest of your life. You don't need to have the scale change in these dramatic ways when you first start.
You actually had an automobile accident?
I did. Severe automobile accident where I broke my femur and crushed one of my feet and almost lost the foot. Oh, and God. So it wasn't physically possible. I was months in a wheelchair.
Yeah, you were hit head on by someone who had fallen
Correct.
asleep at the wheel. So now you can't exercise.
Right.
So Bob, how do you help
I try to tell people, especially if you're dealing with injuries or you're dealing with something that is preventing you from working out, one thing that we all can do is watch everything that we're doing in the kitchen. So if you can't initially get on the treadmill or get yourself out there moving around, what you can do is you can, what I say, work out in the kitchen. You can make sure that you are setting yourself up for success here in the kitchen, as opposed to putting up all these roadblocks for you. I try to get people to clean out all that stuff that you shouldn't be having. We all know what we shouldn't be having, and go from there. Sorry, my dogs are getting a little crazy right now.
So, Lou, if you had Becky walk back in, it was like a year and a half that you were really recovering from this accident. Now you have a totally different patient in front of you.
Right. And you got to prioritize her. The main issues is getting back to her level of activity and her level of lifestyle from the accident. So making sure she's getting the physical therapy that she needs, that her pain is controlled. If she's developing depression from all of this, making sure that's treated. And lots of times it sounds counterintuitive, but it's okay to fail, right? So you can try something and fail as long as you retry something again. That's part of the issue also, is once you get back on it, is to set these small goals, but it's okay to fail as long as we try something else immediately.
And I always find that the longer you're off the track,
absolutely,
it's harder to get back on the track. Dr. Campbell, I would imagine a lot of patients that come to you have already gone through, gosh, we don't even know, months, years of this attempt by the time they get to you.
Yeah, I mean, most people who have struggled with this most of their adult life, that it's characterized much of their adult life, this effort and this regain, then this effort, then this regain. It's been a lifelong hobby, a lifelong effort, and there's all sorts of emotional baggage, of course, that comes with that. And sometimes people, just to tie it to a few other comments, sometimes people are only willing to take small steps. But I would argue that, after speaking to someone, this is really driven by where the patient is. The patient has to be in the right place for this. But if the patient's in the right place for a major change, to totally overhaul diet, with intensive support program, these behavioral intervention programs that are starting to become more common, so the biggest step they can take may actually be the most useful if that matches their motivation.
One thing that I do with clients, the reluctant client, is I will initially get them to say, okay, we're not going to change what you're eating right now. We're going to change how much of it you're eating. So if I'm working with a morbidly obese person that is living on pizza, burgers, or whatever the case may be, if I get them to just cut whatever they eat in that meal in half, they will start to lose weight. And then that's where the motivation could happen, where they see the number change on that scale. They start to feel lighter and better. And that's when you can go in and start tweaking that diet and say, okay, now that you've lost weight, let's start to reprogram what you're doing. That's one thing that I've been able to do that has become successful for that reluctant person that doesn't want to change anything.
But I want to turn to Dr. Sani, because what we're hearing here is that by the time patients get, to Tom at his weight loss center, that they might be aware of their cardiovascular risk. But let's motivate a bunch of other people out there right now watching and talk to us about the relationship between this weight gain and their cardiovascular risk.
It's entirely significant and related, and here's why. One thing that would be important to address that many people don't know is that rapid fluctuations in your weight, so cycles of rapid weight loss or rapid weight gain, is very detrimental to your cardiovascular health. It's been clinically proven to increase the risk of heart attack and stroke, as defined as cardiovascular events. And so when somebody is struggling with those other risk factors, and just bringing it back to Becky, when she went on those steroids, she was at increased risk of developing diabetes. And now she has that weight gain. on her. And now she's developed a motor vehicle accident. And I love that we tuned into depression, because emotional stress eating is very
Absolutely.
impactful for women and can be a reason why extra calories are consumed. But you have to break it down for patients. You have to tailor it to them. And what I really like to focus on when it comes to my male or female patients is how simple it is. But that takes a very tailored approach. So I often ask my patients, what are you eating right now? Similar to what Bob was saying. And you work with what they're doing, because I need them to believe that if they change how they're eating and they change how they're moving, I can get them to reduce their cardiovascular risk. Studies have shown that if you lose 5 to 10% of your body weight, and you can sustain that over a year, but even in the short term, you can reduce your cardiovascular risk factors dramatically. And I'm talking hypertension, your blood pressure numbers. You can reduce your risk of diabetes, but we actually see clinical lowering of the hemoglobin A1C. And exercise is the most effective way to reduce your triglycerides, as is reducing your carbohydrates in your diet. So when you can show patients these data points, they are amazed.
I'm sitting here across from you, Becky. Tell us what happened, after the accident, a year and a half trying to rehabilitate. Then what did you finally do?
4 years ago, I finally made the decision to have weight loss surgery. And my father had had surgery, and I had watched how it transformed his life.
Weight loss surgery?
Yes.
Okay.
And it was amazing. He had been a diabetic. He had had the heart troubles and so on. And I had seen the changes, and I knew that was in my future if I didn't make a change. And so I had the gastric sleeve surgery.
And you say that you had some backlash.
Yes.
That there was like a stigma.
There definitely is a stigma. In fact, many people don't know that I had the surgery. This is kind of a coming out of sorts.
Quite a way to do it.
They think it's the easy way out, but it's not easy.
No.
It's not easy.
Yeah,
it's a lifetime commitment,
right.
regardless. This was just a tool to assist me in being able to.
Exactly.
Because we should point out that there are, of course, consequences that can come with different weight loss surgeries.
Right. It's surgery. And with anything, whenever you do a procedure, you're trading one situation for another. So when you have that kind of alteration in your gastrointestinal system, you're going to have to adapt to new changes. And the reality is you're doing some biochemical stuff to improve weight loss, but the majority of it is just trying to get you to eat less.
But you're not ingesting nutrients in the same way.
Right. So you may have, and that's why they've changed some of the surgeries, some of the older surgeries that were very effective in weight loss, also what caused problems with, certain absorption of nutrients. But there's going to be alterations that you're going to have to adapt to. And it's a shame that there is some stigmatization for it. I wish people would treat, obesity like treat hypertension. No one really cares, And I think part of what Dr. Sani is getting at is there's this societal view of obesity, of where it should be for perfection, and then there's the view for health. And it's tough to get patients to understand even that 5 or 10 or 15 pounds is going to be beneficial. It's a ladder. It's not a cliff. You got each step is beneficial. And anything that gets you to that with data that shows that it reduces your risk for outcomes, which we know about bariatric surgery, is going to be important.
Well, Dr. Sani, does it matter, do you think, how you lose the weight, or is it more important that you lose the weight so you reduce your risk for chronic illness and cardiovascular problems?
So what matters the most is that the approach you use is safe. There are a lot of supplements that are dangerous for your heart that are sold as weight loss agents, and they end up accelerating your heart rate. They can cause dangerous arrhythmias. So it's very important to use a strategy under the guidance of a physician, and to use a multidisciplinary approach with a nutritional coach, exercise. As long as the strategy is safe, then the weight loss is the weight loss. And we see a dramatic reduction in your cardiovascular risk when that weight loss occurs.
So I want to go back to something that Dr. Sani said, which I think was very important, which was the safe aspect of the weight loss.
Okay.
Be honest, there's a lot of garbage out there. There's a lot of stuff out there that promises a lot in a short period of time that's outright dangerous. And I feel this strongly as a primary care physician, because when that fails, or when anything fails, they always come back to me. They always come back to their doctor, dejected, feeling like it didn't work, they failed. very often with complications of it. And I think that safe weight loss thing that you touched upon, Dr. Sani, can't be emphasized enough, because there's a lot of charlatans out there that would like to promise a quick weight loss with a pill or a magic of some sort that really they don't have to deal with the consequences of.
I wanted to ask Bob one thing. Does it matter? Everybody wants to know, do you have to be running because everybody isn't comfortable running? Is walking enough? Like, how much is enough?
I get people all the time coming up to me saying, Bob, I know I need to lose weight, but I just hate running. I'm like, well, girl, running is not what I'm going to have you do then. You've got to find something that you
like.
enjoy,
Absolutely.
that you get up. And I think that the people out there that are saying, I have the exercise program that is going to work for you, I always am so super skeptical, because what I want to get people to do is find something. If you want to dance around and do TikTok videos all day, that gets you up and gets you moving around. That's what I'm trying to get people to do, and not just think that it's got to be this one thing, because it's just not the case. We've got to get excited about it. I want to get up in the morning and go, oh, I'm looking forward to going on that walk with my dog, or I'm looking forward to that dance class I'm going to do on Zoom today in my garage. It can be anything as long as you are moving around.
Yeah, because as soon as you get on a probe and you start seeing results, right, Becky, then that motivates you. How has your life changed?
It's more of a self-esteem.
Yeah.
Very much so. Your mindset shifts. I am able to walk more, not pain-free, but definitely reduce pain, and can do a lot more.
But when you start to feel good about yourself, doesn't that kind of just open your mind
Absolutely.
to having more possibilities in your life?
Absolutely. I have two girls I need to be around.
Right.
Absolutely. I want to just have everybody talk about this, because we all know losing weight is really hard.
Right.
And starting an exercise program is hard once you get into it, but starting it is really hard. But being overweight and sedentary, we know, and we've been talking about, is so hard on our body and on our heart and on our longevity. So I want to go around to each one of you and quickly just give us one piece of advice to our viewers so that they can be motivated and have a sense of being able to start conquering their own obesity. You can start us out, Lou.
So I would say work with your medical team and be consistent, because things are going to fail. You're going to be discouraged, but consistency is the key. Being consistent.
All right, Dr. Campbell?
I think people having a plan and support is very important. So, people have to sort of assemble some resources and plan out what they want to do, and then take action with some support behind them, whether it's support of a medical team or a dietitian, or just a one-on-one dietitian or some other intensive program. I think that's where people are going to get the most success. A lot of times people just kind of, I think, vaguely kind of think, oh, that sounds kind of interesting. I'm going to try some things from that. And it never quite reaches the point of seriousness that's going to lead to their success. And it's going to feel kind of frustrating. So I think having an excellent plan in place and the support to back it up.
Yeah, I actually find that if I put in my workouts onto my schedule, right along with all of my business appointments, and it also helps to get up and put your workout clothes on and your sneakers, so you get it, because otherwise when you find yourself at 4 o'clock in the afternoon and you haven't done it, but you're dressed for it, it's a great guilt.
Remember that 80% of heart disease is preventable. So bring your sneakers with you so you can be active throughout your day, because it's the cumulative effect of exercise that can have an additive benefit. And when it comes to thinking about what you're going to eat and diet, keep it lean, clean, and green.
Good way to think. How about you, Bob?
Okay, I'm going to say something controversial because I have worked with overweight people, as all of you have, for such a long time. And one thing that I've always said is you can't do it alone. You've got to surround yourself with like-minded people.
Absolutely.
And if that means taking a group fitness class that will get you in a room with people that are sharing your same goals, you're going to be more likely to have success.
Becky, what do you know now that you wish you had known before you began your weight loss journey. So what advice would you have for people out there who are also really struggling?
Everyone's journey is different. Just do what you can to do the best job that you can and get to the end, whatever your goal may be.
All right. Well, it's been so nice, to come here. I know it's always not easy to talk about this, but we thank you for sharing your personal story. And we thank everyone on our panel, of course, and doctors, thank you. And thank you for watching. For more information about the series, you can go to secondopinion-tv.org. And you can also follow us on Facebook and YouTube, where you can watch today's episode and much more. But from all of us here at Second Opinion, we encourage you to take charge of your health care. I'm JOAN LUNDEN. Be well.
When our communities need help, Blue Cross and Blue Shield companies step up with partnerships capable of preparing meals for thousands of families in need. Because it's not just about health insurance. We believe it's our responsibility to expand care to rural communities, protect our heroes with safety equipment, support local nonprofits. These are our stories to help build stronger communities for the health of America.
Second Opinion with Joan Lunden is produced in conjunction with UR Medicine, part of University of Rochester Medical Center, Rochester, New York.